Hi, folks. I am Jason Bains, and I am a registered clinical counselor. My journey into mental health started with my own recovery. I'm someone who struggled with substance use for a period of time in my life, and I went to residential treatment, and that was my first taste of therapy, group therapy. If you've struggled with addiction and if you've been exposed to recovery, maybe you probably heard about this idea that, you know, when you have substance use disorder, you always kind of feel different ever since a kid, as long as you can remember back. And I remember that feeling. I remember being very reserved and going within myself and kind of being scared. But then you fast forward to today, and I'm a father, I'm a husband, I'm a man who lives in recovery. I'm very passionate about just growth. So I'm definitely someone who looks at growth as this lifelong journey. If I was to say it simply, the clients I support the most are clients who have had trauma, some old wounds that are showing up in their life today, relationship issues, addictions, and then life transitions. I would say that I have three main approaches to working with clients. I'm attachment focused. I look at things from an attachment lens. And what I mean by that is, I believe that our earlier experiences, our experiences growing up in our childhood homes, are incredibly impactful in terms of shaping the way that we can view the world. And then in addition to that, I believe human beings are incredibly complex people. The way we view our issues, the way we view anything, we can have different parts that show up around one thing. Doing parts work and helping clients to kind of flesh those parts out and then connect with them. The other one that shows up a lot is dialectic behavioral therapy, and it helps a lot with emotional regulation and often something that can just support clients with whatever they're navigating. The counselor Jason is definitely different than if you were to meet me, or if I'm just kind of hanging out at home with the family. If I'm at home, I just want to be having a good time laughing and kind of joking around. But then when I'm in session, I don't want to lose that part of myself because I believe, a touch of humor is important, and humor helps me connect with the client, but also, we're there to get to business in a way. Like, you're there because you're navigating some painful things, and for the clients that I work with to be able to feel safe and comfortable. And I'm a big contributor to creating that space and ensuring that I'm kind of checking in on that throughout the relationship. I'm someone who, after a few sessions, we're going to check in on our relationship. How are we doing? Something that I'd want you to take away from the work that we do together is coping, to just be able to cope better, no matter what life brings your way. I really believe that oftentimes it's not so much about the event, but think about, how is it affecting you? How much distress is this causing in your life? Because then the event, it doesn't have as much weight or power, and we don't need to compare it because we all experience things so differently. If you're in pain or if you're in distress, then let's not minimize that. You deserve some support as well.